How deep should I be squatting? It's a common question I get asked. For some people, it's quite controversial. What I'm going to do in this tutorial is talk you through what I think and why I think it. To answer the question straight up, how deep should I be squatting, or how deep should you be squatting? I'm going to say, very simply, it's as far as your neutral spine will allow. Now, before you start chucking a load of comments down in the comment section below, please let me explain myself, because there are reasons for me saying that, and what I'm hopefully going to do is outline that, so at least whether you agree or disagree, you'll be able to understand the context as to why I've come to that conclusion, and you may even agree that in the context that I'm talking about, that it's correct. So you may want to watch all the way through, because what I'm going to do is essentially talk you through some of the reasons why and some of the factors affecting how I came to that conclusion, and the different aspects of the squat, and why essentially they're telling us to do it in the way that I'm describing. Number one is there's a difference between a loaded squat and a bodyweight squat. So when I say as far as your neutral spine allows, I'm talking about a loaded squat. So that's a squat with a weight. Could be a barbell, could be a kettlebell, whatever. So we have to understand that there is a difference between putting a weight through the spine, or putting load through the spine, and not putting load through the spine. Basically, when we put load through the spine, it puts extra stress and extra tension on the spine. If it's in a flexed posture, or certainly the lumbar part of it, if it's in a flexed posture, then there's extra stress and tension on the area. Now, what I should say at this point, that there are essentially, you could say, like 3 levels to it. So from worst to best, the worst way of loading the spine is going into a flex posture, having loose abdominals, and then trying to lift. That's going to put the most stress and tension on the spine. Level up from that is going into a flex posture, bracing the abdominals, and then lifting. So that's kind of number 2, because the brace will distribute some of the load around the spine, but the flex posture, it will still have an effect on the intervertebral discs and the ligaments and the muscles that are around it. Obviously, the best one is the neutral spine, down, brace, get the lats engaged, and lift. So those, in some respects, are like the 3 levels of a loaded squat. When we're talking about a bodyweight squat, it's very easy, because there is no load on the spine. We can go down into these types of positions, we can round the spine, and it's going to have a little of an effect, unless the person has a flexion intolerant spine and they get back pain as a result of that. If they're in that category, again, I would recommend they wouldn't go into that flexed posture, because if they've got flexion intolerance, then that flexed posture is just going to trigger and exacerbate the problem that they've got. Number 2 is movement versus exercise. Movement is very different from exercise. As I've mentioned, it's very similar to the loaded versus bodyweight squat. So movement is movement. It's everyday movement that we go about life. Yes, we're going to lift boxes. Yes, we're going to be carrying things. Yes, we're going to be loading the spine. But it's much more varied and it's much more spread out through the day. Whereas exercise is very concentrated, and because it's done in an hour, and it can be very repetitive. So it's that concentration and repetition that is going to increase the stress and the tension on the lower back if we're not doing it correctly. Obviously movement, because it's spread out over another 15 hours a day. So I'm assuming that we sleep 8, we exercise 1, and then we've got 15 hours left. So we've got a lot of different postures, movements, positions, and loads that are very spread out. But again, this is all dependent on the condition of the person's back. So I'm always going to include the individual in this, because this is where it starts to depend on certain factors. So again, we have to understand the difference between everyday movement being very spread out and varied, and exercise, which is concentrated and potentially very repetitive. Number 3 is the sport and the sports person. So what most people will say is, but my sport requires me to bend my spine or twist my spine or whatever. And that's absolutely fine, but again, it depends on the individual. Do you have history of back pain? If you don't, it's a different sort of set of rules that we would use or that I would use. And again, it depends on the sport. Now, if you were playing your sport event or match or whatever on a weekly basis, then you're going to be potentially putting stress through your spine on that one event once a week. Now again, I'll use the example if you've got a flexion intolerant spine. If you're doing that all the way through the week, then you're going to be exacerbating the problem all the way through the week and then doing it again in your sporting event. When you use the neutral range, what you're essentially doing is building a margin of safety and a margin of error around your spine. So when you come to the event at the end of the week or the match or the whatever at the end of the week or once a week, whenever it may be, you've got that margin of safety to eat into, and then you could build it back up over the week. Eat into it, build it back over the week. So you can start to sort of build that picture of, in some respects, how the body's working. So when it comes to the sport, you have to understand the sport and what are the requirements of the sport, and then you have to understand the sports person doing it and what condition are they in. The fourth thing is why. So one of my questions is, why do you need to go ass to grass? Why do you need to fully squat? Again, if it's just for healthy movement, then that's fine. But we don't need to load that. We don't need to do a bunch of loaded squats for good, healthy, full squatting. We just need to practice full squatting. So again, it depends on the reason as to why you're doing it. So what I'm trying to do here is help people understand that you can't just blanket term everybody needs to full squat. And what I'm going to do next with these factors that are affecting it, I'm hopefully going to help you understand a little bit more. So what we have to understand is, why are we doing it? What does the sport require? What's the condition of the individual? And do we understand the difference between a loaded squat, a bodyweight squat, movement and exercise? Now we're talking about factors that are going to affect it. So some, let's just call them personal factors or biomechanical influences or something like that. Because what we're going to talk about is the position of the weight, the limb length, the valgus knee, ankle mobility, foot position, hip wink, rounded spine and hip joint structure. Number one is position of the weight. If you've got the weight on your back, you will find it very different squatting if you've got the weight on the front. So if I just use, not that this weighs a great deal, maybe a few kilos, but if we put that on the back, but what it will do is shift my centre of gravity backwards, which is going to influence how far I can squat. And if I'm maintaining that neutral range, again, it's going to influence that. So I kind of come into that position, you can kind of see how far I can get down, and if I go any further, I'm going to start to round my back. If I put this weight on the front, you'll see something very different. So I can go down that little bit further, and I would do what most people would say is a tick in the box, and that's get down to that sort of parallel position. That's just very simply shifting the centre of gravity. So I kind of then go back to what I was talking about earlier. Why do I need to get that deep? If I need to get that deep, it's going to be better for me to do a front squat than a back squat. So I have to understand that. What does my sport require? What's the condition of my back? All those different things come into that. Why am I choosing front squat over a back squat? So we need to understand that first. So again, as a blanket term, just to say ass to grass or parallel isn't necessarily a great teaching point. It's much more effective, if you are going to just throw a term out there, it's much more effective just to say keep it in the neutral range. If you get to know the athlete, if you get to know the sport, and this is what I think a lot of people are doing, they're taking very specific scenarios and throwing it out into the big wide world of what squatting could be. And then everyone's having their piece on it, but not understanding the context in which it's being said. That's kind of what I'm trying to do with this tutorial, is help people understand that there's context out there. There are a lot of variables. So number one is the position of the weight. Number two is limb length or bone length or whatever. I'm just going to talk about the femurs. Now, again, if I use this and I do a back squat, now I would be described as someone who has relatively long limbs, or an ectomorph who has sort of longer limbs as a sports person. Now, again, if I come into this position, now this is all about centre of gravity again. So if I go into this back squat, I can get down that far because what's happening is the weight is shifting my centre of gravity back. Now, if I kept going down, I would fall backwards. If I had shorter femurs, so if I had shorter legs, this bone here from my knee to my hips would stay much more over my heels and potentially towards my midfoot because my ankle would go further forward, which sort of brings in the next one, which is ankle mobility. So if I've got shorter femurs, I'm going to be able to get down further. So again, we have to understand the individual. What's their biomechanical makeup? Do they have long femurs, short femurs? Do they have short femurs as opposed to tibia? Do they have short torso as opposed to short limbs or long limbs? So we have to understand that because all that is going to influence the centre of gravity, which is going to allow us to either go further down or need to stay up. Because what you might find is that the taller, more long-limbed people find it very hard to squat down, whereas shorter people find it much easier to squat down further. So again, it's another variable that we have to take into consideration when we're just saying you need to go parallel or you need to go ass to grass or whatever. So number 2 is limb length. Number 3 is valgus knee. Now valgus knee is essentially the coming in here. So the dropping in, so if my hip and my ankle and my knee's inside it. That's essentially what a valgus knee is. Now, if people have got valgus knee, we may find that that's influencing how far they can go down. Now that ties into what is going to be, or what would be the next one, which is ankle range of motion, or ankle range of movement. Now, if someone has poor ankle range of movement, what that can be doing, now again, we could take this off onto another tangent, which I'm not going to do, but if we've got someone that's got minimal ankle range of movement, what the body can do to help them get lower is it can pull their knee in and allow them to go down. Because what the body's essentially doing is the knees can't go forward, so it's got to create another way for them to do it. It can turn the feet out, which we'll talk about in a second. So what is their ankle range of movement like? Is that causing the valgus knee? Because if we've got good ankle range of movement, again, what we can do is when we come down, our knees come forward, you can see my centre of gravity comes forward. So I could have long limbs, but if I've got really good ankle range of movement and I can get my hips forward, then that's going to help me get lower. So it doesn't just mean that long femurs can't squat deeper, as long as they've got good ankle range of motion. So we have to look at all these variables and how they tie together, and then it builds a picture of what we can do with them. I mentioned it briefly in the last part, but the next one is foot position. Now, what a lot of people will do is they will go very wide. Now, as I mentioned before, is that's compensating for poor ankle range of movement, because what will happen is they will go sort of toes out and they'll go into this sort of position, which is creasing up all that's happening here and not allowing these muscles to work properly. We've got about a 15-degree play with regards to toes out. So 15 degrees out is fine. If we go much further than that, what we're not able to do is create the torque through the glute medius, glute minimus, to be able to stabilize the hip. So we have to take that into consideration, is does their squat change when they come into this more sort of neutral foot position or slightly toed out foot position? Because if they're doing this, they can't get the activation through glute medius, glute minimus. But if we come in here, push knees out, we can get down into the squat with a much more stable hip, which is going to save the lower back. That also helps with the knee, but that will depend on what the ankle can do as well. So number 4 is foot position. Number 5 is a hip wink or a rounded spine. So as I've mentioned before, when we go into certain positions, or if I just use this one, we come down, at some point we will round. I've got a weight here, so this is now putting unnecessary stress and tension and compression through my lower back. Now, what the hip wink is doing, that's basically looking at the S1, L5 segment. So when the hip sort of breaks away from the spine, that's putting pressure on that segment and that disc. As we move up into the rounded spine, it then starts going up L5, L4, L4, L3. So it starts to move out. So depending on where someone has their disc herniation potentially, will help you understand what was going wrong in the squat. If it's at the L5, S1, it's probably a hip wink. So that range of movement of the hip is going to determine how far down they can get, because it's going to basically elicit the hip wink or the rounded spine. The final one is the joint structure of the hip. Now, with regards to the femur, obviously it joins into the pelvis. Now, there can either be a shallow socket or a deep socket. The socket could be slightly pointing forward, it could be sideways, or it could be pointing slightly backwards. All of that is going to have an influence on how far down they can go. The shallower the hip socket, the further down they'll be able to go. The deeper the hip socket, the less further down they'll be able to go. Plus, with the anterior, posterior, or lateral sort of aspect of where it makes the femur point, is also going to have an influence on that. Now, when it comes to things like that, unless you've actually got an MRI or an X-ray of their hip and you know that position, then it's going to be very difficult for you to suggest that they should go down if their hip joint isn't designed to do it. So the one thing that will, in some respects, be the safest for most people is to maintain that neutral spine, or maintain that neutral range. Obviously, all those different factors will come into it. But if you don't understand all of those factors, then it's going to be more important to maintain that neutral range. So where I said it's a very simple answer, it's a very simple answer built on all those different influences and all those different understandings with regards to the movement versus exercise, the body weight versus loaded, the sport, the sports person, and why they need to do it, so the goal that they might have. And obviously the factors affecting, as I've mentioned, the position of the weight, the limb length, unless you're actually going to measure the limb length, the ankle range of movement, which is going to influence the limb length. So if they've got long limbs and really good ankle range of movement, they can go deeper. So you need to fit all of this together to be able to understand how far down, first of all, they can go, and then how far they then need to go. So how deep should you squat? Well, it depends. But if you want the most simple, broadest, safest position to go in, it's as far as your neutral spine will allow you. But again, that will depend, and that is for a loaded squat. If it's a body weight squat, it's a different set of rules that we play by. So hopefully this has been helpful. Hopefully it's given you a better idea of how deep you should squat. And hopefully you could take some of this information with you into the future when you are squatting. So many thanks for watching. My name's Chris from Chris for Whole Training. I'll speak to you in the next tutorial.